Good morning and welcome to all of you for joining us for the inaugural Distinguished Speaker Series event of the new Center for Public Health Advocacy. We are honored to welcome Senator Barbara Mikulski as our keynote speaker for this special event. I am Uying Rimon, one of the founding directors of the Center for Public Health Advocacy and concurrently the director of the Bill and Melinda Gates Institute at Johns Hopkins School of Public Health. But before I introduce our speaker and the moderators, please indulge me for a few minutes to tell you about this new center. The Center for Public Health Advocacy was established in December 2016 with inspirational backing from Dean Mike Clegg, who is here with us today. Mike, thank you. And with the support of the school's advisory board and health advisory board. Not sure if Bob Bloom is here. Bob Bloom, then the Population, Family, and Reproductive Health Department Chair, where CPHA is housed, played a key role in helping conceptualize and making the center a reality. The new chair of our department is here with us, Dr. Cynthia Minkovich, who is also a very strong supporter of the center. Let me also acknowledge David Jernigan and Beth Friedrich, who are my co-founding directors of the center. We work with a larger interdepartmental advocacy working group in developing the charter of the center. And I see some of you here. Somebody's hiding in the back. Dr. David Holtgrave, chair of the Department of Health, Behavior, and Society, was one of them. Our Nobel laureate, Peter Agri, was also helpful. Susan Crane of CCP. It's right there. I'm sure there's several others here, but forgive me if I can't see you or mention you. The center is a cross-departmental initiative aimed at facilitating advances in advocacy research, teaching, and practice, the three pillars of the school. Connecting leaders across public health disciplines and training future public health professionals who are skilled in advocacy as they are in science and public health practice. The center is only one of its kind in any major public health school in the US and Europe. I would also like to acknowledge the future leaders in family planning. The new leaders of family planning, they have just been identified about 2 weeks ago, and they are here with us, the 120 under 40. 15 of them from all over the world came and joined us. You're welcome. About 2 years ago, we hosted a high-level meeting of advocacy thought leaders in the US and in the world. In this same room, we had Senator Ben Cardin of Maryland as our keynote speaker. Today, we have Senator Barbara Mikulski with us. We are indeed blessed. I will introduce our speaker and our co-moderators, and then Dr. Cohen and Dr. Jernigan will lead us through a discussion with Senator Mikulski. We will take a few questions from the audience at the end. Dr. Joanna Cohen, right here in front of us. Dr. Cohen is the Bloomberg Professor of Disease Prevention and the Director of the Institute for Global Tobacco Control. A leader in the field of tobacco policy, Dr. Cohen has been involved in tobacco policy research for over 20 years. Her research focuses on the factors that affect the adoption and implementation of public health policies and on evaluating the beneficial effects and unintended consequences of such policies. She has been recognized for her teaching and mentoring and has co-led a 6-year training program in public health policy. David Jernigan. Dr. Jernigan was an advocate long before he discovered public health, working on campaigns around issues such as peace and social justice, gay and women's liberation, and ending apartheid in South Africa. Before becoming an expert in alcohol policy and supporting movements around the world to enact and implement healthier alcohol policies. At the Bloomberg School, he's an associate professor in the Department of Health, Behavior, and Society, heads the Center for Alcohol, Marketing, and Youth, and is one of the co-directors of the Center for Public Health Advocacy. Now for our distinguished speaker. Senator Mikulski is a trailblazer and a fighter. She got her start as a social worker in Baltimore, helping at-risk children and educating seniors about the Medicare program. Her work as a social worker evolved into community activism, which later evolved into advocacy. Senator Mikulski started her political career with a successful run for Baltimore City Council in 1971. In 1976, she was elected to Congress representing Maryland 3rd District. In 1986, she was elected to the Senate, where she was re-elected with large majorities in 1992, 1998, 2004, and 2010. In 2011, she became the longest-serving woman senator in U.S. history. Congratulations, ma'am. And in 2012, she became the longest-serving woman in the history of the United States Congress. Congratulations again, ma'am. She was awarded the Presidential Medal of Freedom by President Obama in 2015. Senator Mikulski has spent her career working to protect the most vulnerable members of society and to advance scientific research and democracy around the world. Senator Mikulski retired from the U.S. Senate this year, and we are now lucky enough to have her at JHU as a Homewood Professor of Political Science and advisor to President Daniels. Can we call you now, ma'am, as Professor Senator Barbara Mikulski? So Senator Mikulski will deliver her remarks, and then our moderators will take over. Thank you very much.
Well, my remarks are going to be very brief. First of all, thank you for those words of kind introduction. And often my longevity of service is what's enumerated, because it's a nice little metric. You know, you wanted evidence-based that I really showed up every day. But really, it's not how long you serve, but how well you serve. It's better to serve one term and do a great job than hang around for 4 terms and not have made any kind of footprint or imprint on our community or our country. So, and that's the point of really this great program that's been inaugurated this year on public policy and advocacy. First of all, it's great to see Dean Clagg here, and also to comment on his forward thinking and of the leadership of the university, that on the centennial of the School of Public Health, that it's thought to do something no other School of Public Health has done in this country, which is to have an area of study and practice in the area of advocacy. And I think that this whole endeavor is going to have a big impact on your life as you follow your dream and your career, but it's going to have a big impact on the way we educate public health professionals. If Hopkins leads the way, the Bloomberg School leads the way, eat your heart out, Chapel Hill, try to keep up with this Harvard, and you get the picture. So I know we're all, collaborative people, but a little rivalry and competition is pretty good. So, and why do I say that? Well, first of all, it is my belief that there is no problem that a community, a country, or the world is facing that does not have public health underpinnings. To either recognize it as part of what are the issues and the problems, or to what are the solutions. And that's everything from hunger and underperformance of children in schools because of the social epidemiology, which is an important component, to all the way up to the issues of war and peace. And when you look at our world today, first of all, we're now into 2017, this new century. So as kind of a vintage elder here, I'm going to say this century didn't get off to the start that I had wanted. So I lived through and was born in the 20th century. And I have participated as more like a foot soldier in every great social movement that this country had in the last half of the 20th century. And as I was a senior policy maker in the United States Senate, I was looking forward to this new century. I thought we were going to finally corral the four horsemen of the apocalypse and make sure we were going to get rid of war, famine, genocide, and the other isms in our world, whether it's racism, homophobic, all of these things, and that it was going to be a new century, a new day, and a new way. Well, we've gotten off to a pretty bad start, and we're looking to you, and I was so glad to get a picture with the 40 under 40. Oh, to be 40 again. But I might have done something with myself if I were 40. But we need you. And one of the reasons is that in leaving the Senate, I wanted to come to Johns Hopkins, was to be able to help you all learn about the world and how to change the world. And to have an esteemed institution, a globally recognized institution, to say that how you can be an advocate is absolutely crucial. So I look forward to this conversation because you're needed. You are absolutely needed. We need you. First of all, we need your energy. We need your ideas. We need your ideas. It's a new century and takes new thinking. And we need your idealism. Goodbye to skepticism and hello to idealism. And know how to take that idealism and really put it into practice. So I'm counting on you to rescue the century. And I hope that this today is a kickoff to do that. The reason I wanted a Q&A, I thought, I speak from these podiums. They never work. They're always so big for me. And I have to carry my little stool and do all that kind of stuff. And I thought if we could go into Q&A here from these great professors and then Q&A from you, we could see what would benefit you as you think through what you want to do. But I think I'm going to congratulate you. You wouldn't be here if you weren't terrific. But being terrific means that we have an obligation. And if you look at all those, I'm not going to get into the politics of politics today, but if you look at all the people as the Obama administration came to an end, most of us have gone into academia. The president guest lectures there. Vice President Biden is at the University of Delaware, and we could go all the way through it. And why do we want to be here? We want to help shape the next generation so we can shape this century. So.
Excellent. Well, what wonderful opening remarks. Thank you so much. So I'm going to start off the questions and go almost to the beginning. And Oying mentioned in the introduction that you started your career as a child welfare social worker. So can you tell us a little bit about how that turned you into an advocate?
Oh, absolutely. So first of all, I grew up in Baltimore. I've lived in Baltimore all my life. I've gone to Baltimore schools all my life. I'm Roman Catholic. I went through Catholic elementary school and all-girls Catholic high school, Catholic women's college that merged with the Jesuits. And at one time, I thought I wanted to go into science. I'd seen the movie about Madame Curie and back in the day, and I thought, oh boy, I'm going to find some big cure. But I was very klutzy at physical science. And what I found, though, is I had a gift for social science, and I went into social work. I really wanted to help people. Started out as a foster care worker at Catholic Charities, but I wanted to prevent. Prevention has always been, even then, as a very young woman starting her professional career, prevention. So I wanted to prevent family breakup before we had to turn to removing children from their home. A very wrenching experience. So I then went to work at the Department of Social Services in a division called Protective Service. This was child abuse and child neglect. And the more I worked with the families where they had been to court for, quote, neglecting their children, I saw that the neglect was not the parents, but it's what the parents were facing. And that I could do all the counseling in the world. I could know Freud. I could know Jung. I could do a psychological diagnosis. But they still didn't have a job that got them out of poverty. They still lived in segregated housing where they were redlined and sidelined, and that there were no buses. So everything that I turned to. And then when you search for government programs, where were the job training? When we had manufacturing in Baltimore, where were the training for welders, et cetera, et cetera? So I realized that I had to get involved in terms of the systemic issues. And along the way, while I was looking at this world, there were two things. Number one, well, there are many things, but one was the whole fervor of social movements. And we can never underestimate the impact that the civil rights movement had. The civil rights movement not only improved the lives of people of color, it improved our society and focused on the issues that America had to shape up to what America was and practice what we preached. And getting involved in the civil rights movement here, and again, we were a segregated town. This was a segregated hospital. So was Mercy. So were the churches. And anyway, so that took me into wanting to go to graduate school. There was a new field, just like all of you. It was called community organization or social strategy. Most people went to graduate school for counseling. My supervisors told me I didn't have a therapeutic personality. I think I do. Don't you find me warm and fuzzy? And then you confide your secrets to me? So, but there, it was, our job was to learn how to help people organize for self-help and to how to be good at it. And that's what took me down this path that brought me into this. Because as you help people, you're going to see that every issue has an issue that requires advocacy. And I hope you would see the same. Anyway, I could go on and turn this into a monologue. We better go to the next question.
That's right, because
Senators do that. We automatically go to filibuster. Just, it's a Pavlovian response.
we certainly find listening to you therapeutic. So you began advocacy really at the street level.
Yes.
And how did those experiences with advocacy enable you to be effective as you moved on to advocate in other spheres?
Well, first of all, that there's a body of knowledge. And I go back to the University of Maryland School of Social Work, which was pioneering in really this community organization, social strategy approach. And the tools of organizing, because most grassroots organizing were coming out of the social movements or those who wanted either to advance social progress, like the civil rights movement, or those that wanted to impede the progress, like the white supremacist movement. So during the civil rights movement, remember, Wallace on the courthouse door, segregation today, segregation tomorrow, segregation forever. And it was still a legacy of Jim Crow. So what I was learning at the School of Social Work was how to organize people and the basic principles. Meet people where they are. Organize on a felt need, not what you think the need is. Organize what the people are. Identify and have a power grid. Who's got the power? Who can affect the decision? Is it local, like zoning? Were there fair housing laws? There was nothing fair about our housing. And then also the political solutions and involved primarily in voter registration so that you didn't lose, I mean, voter registration is not signing up for a political party, it's signing up to get yourself to vote. So, and then it was really the training of the grassroots movements themselves. So it's great being at the University of Maryland. I have fantastic professors like you have here. But when you go into a church and you're kind of a white, chunky liberal in her 20s, and you kind of feel awkward and think, well, I've never been in a march or a demonstration. This was a new phenomenon, really, in the 60s, because we'd lived through the war, World War II, and the 50s, and the Cold War, a time of great emphasis on, homogenized society. And when you learn how to march and you're with somebody who you've never met, you've never gone to church with, you've never had a meal together, and really you couldn't, because in downtown Baltimore, if you were black, you couldn't go into the restaurants. You could go into the dime store, we could have had a hot dog together. So you learned, and I learned not only to put on my raincoat, what to do if I was arrested, lay on the floor, all of those kinds of things, but I learned also that for every outcry, which protest is, there has to be an outcome, and all of the organization that goes into it. So it's just not showing up, it's the organization. And then what were we advocating for? We knew that our advocacy, not only the tools to participate in a march, but what was our agenda? And our agenda had to be specific, and it had to be achievable, and we had to focus on the decision part of who had the power. So I learned a lot. And you know what else I learned? That most people who participate in advocacy do it at great risk to themselves. In many instances, not only their personal safety, but also I knew that this was an extra thing I was doing. I had a pretty hot career ahead of me as a social worker. I was viewed as a comer. I was viewed as one of those 40 under 40 types then. But here were people who were doing it on their own time, where they had to take off on their own dime, paying their own expenses. And they could lose everything, including their job, for being an activist. So the first thing you learn is the importance of organizing, the importance of having an agenda, and the importance of humility. That you might be in it, but there are people in it who are making far more sacrifice than you ever will to be in it. And you've got to honor them for their participation.
Great. Very wise words. So moving on, you're now Dean of the Senate Women. And unfortunately—
That's a big leap.
Yeah, it is a big leap.
And making my picket sign, we shall not be moved to.
And unfortunately, we're still hearing in the news problems with women succeeding in all kinds of occupations. So, but as a Dean of the Senate Women, can you tell us a bit how you were able to use your advocacy skills to bring women together to be effective in the ways that you talked about?
Well, sure. So, when I went to the Senate, I was already a 30-year overnight success. And I say that because I had been in the city council, involved with the people in the community, and they had sent me to the House of Representatives. And that was a 10-year endeavor. When I went to the United States Senate, there had, in all of American history, only 19 women had served. 19 women had served. And of the 19, only 5 had been elected in their own right. The other 14 had been chosen to succeed their husband. The way the Constitution works, if there is a death or a retirement when a senator or a congressperson is in office, Congress has a direct election, the House of Representatives, but senators are appointed by their governor. So somebody would die or go to the cabinet, and the governor of that state often appointed the spouse, who was presumed to be a caretaker, to sit down shut up, and at the end of the term, hang it up. You telling me to move
No,
on?
no,
Is that why?
not at all.
Well, so when I came, there was only one other woman there, but I will tell you, and this goes to, for the women, particularly the Democrat, for the women, it was never about girls versus boys. And also what I had was where men were, both my mentors taught me the rules of the Senate, but also champions. And Senator Paul Sarbanes, my counterpart, was my champion because he spearheaded an effort to help me get on the right committees. He also showed me not only the formal corridors of power, but the informal corridors of power, and how I could become one of the gang, but never become one of the boys, which I didn't want to do. And what I then did was keep notes on what I was learning. In 1992, we had the Year of the Woman. It was a reaction to Anita Hill. Many of you don't know, but Anita Hill testified on a Supreme Court nomination. Clarence Thomas was publicly humiliated and vilified by the Senate, and it caused a tremendous outrage and backlash around the country. And more women ran for federal office than had run in the previous 20 or 30 years. When the women came, and it started with the Democratic women, I said I would have a power workshop. I began to organize. And the first thing that I wanted to organize was them to be effective, to do for them what Sarbanes and Senator Byrd and Senator Kennedy and others had done for me. So the press said to me, "Are you going to have a tea?" I said, "No, we're teed off. We're not going to have a tea." And we're organizing a power workshop. What was that? So the women came, we learned, and I went through that. How do you get on the right committee? How do you set up your office? How do you get ahead here? Meaning not in an aggrandizing way, but to be effective. Now, we did that, and it worked out very, 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 very well. And yet, at the same time, then there were Republican women. So a Republican woman from Texas got elected, and she gave me a call. This goes to the dean in a minute. So that's how I became the dean. I was the longest serving, then it was Senator Casabrown, but the longest serving Democrat, because I was the only one, so that was it. And remember, what I wanted to do was to help them be effective. And that goes to the organizing and the effective. You can organize outside, but you can organize inside. I wasn't telling them what their agenda was. We're elected for states. But also, you know, the Constitution tells us you represent a state. You don't represent a political party. You don't go to represent a gender. But we knew that would be the subtext. So anyway, I get this call. Senator Kay Bailey Hutchinson would like to talk to you. And my staff said, ew. Ew, ew, ew. Why do you want to talk to her? She's this conservative woman from Texas. And she had an idea on the economic empowerment for women. Her staff in the meantime said, why are you calling Barbara Mikulski? She's that liberal, firebrand, mouthy, take no prisoners Democrat from Maryland. She said, but she's the leader here and knows how to get things done. Anyway, I'll go through I won't go through the legislation. We got together, and this goes to Judge Knott. I responded to her idea and her desire to at least extend a hand across this aisle that you keep hearing about. So we talked a bit, and we decided to go out to dinner. We had such a good time. We had a great time. And we said this was so much fun, getting to know each other, getting to talk with each other, and let's invite the other women. They came. The Democrats came, and there was only two other Republican women, Casabrown and Olympia Snowe, who I knew from the House. Anyway, we decided that we wanted to work together. But we were very different. Some of us were pro-choice, some of us were not pro-choice. On economics, some were for the line item veto. I'm a government spend person. So where could we find common ground? Well, first of all, we decided we would not be a caucus, we would be a force. So the first way of conflict is not to bring people in a box where we all have to follow a rigid ideological litmus test. The second thing is we would try to find one issue that we could agree on, and I'll come back to that. But what we all agreed upon, because it was the beginning of the rise of very prickly politics in the Senate, and we decided we would be a zone of civility. We would be a zone of civility with each other. So when we were in committee, whether you were offering amendments or on the floor debating, that with each other, we would operate on mutual respect. Our debate would follow intellectual rigor. We would not demonize nor personalize what we were doing, either with each other or with the men in the institution. And when the day was over, end the day, don't carry a grudge. So the zone of civility became this. So we got off, and then when we looked at all of the issues, there was only one issue we could agree upon: women's health. And in the area of women's health, there was only one issue we could agree on there, because we could get into birth control, Planned Parenthood, et cetera, was funding for NIH and breast cancer research. And we said, let's go for that. Then there was another issue that came up, which was mammogram quality standards. Because in those days, there were no national mammogram quality. They were doing it with chest x-rays, either the protection of the person or for the people who work in x-ray fields. So we got into that. And each issue was a confidence-building one. And that's how, now 25 years later, those women are still meeting on a monthly basis, even at this enormously toxic Superfund site kind of politics.
That's great.
So my mom was a public health nurse, and I don't know what you grew up listening to your mothers complain about, but I grew up listening to my mother complain about public health research, and in particular about the studies at that time that were primarily of men that claimed to be finding conclusions that were relevant to women. And one of your major achievements in 1991 was the creation of the Office of Women's Health Research at NIH. How did you use your skills in advocacy to do that?
Well, first of all, it started, remember, at that time there were only two of us in the Senate. Senator Kassebaum, a wonderful senator from Kansas, and the women of the House, and I'd served in the House. So we'd heard about, we had so many reports, you know, we've been through the evidence, et cetera, on how women were being systematically excluded from protocols at NIH. The famous study, take an aspirin a day, keep a heart attack away, was on 10,000 male medical residents, not one woman. So, and every time we would respond, we would have a press release, we would do a press conference, ho-hum, and we would get brushed off. So, I decided it was time for confrontation. That when you are ignored, you've got to stop being ignored. You start off being polite. I believe in polite. I believe in polite as a lifestyle, not a tactic. So, but I called my friends in the House, Pat Schroeder and Olympia Snow, and they said, we're in. And we decided to go to NIH, tell them we were coming. We asked for a meeting with all of the heads of the institutes of NIH, and all we wanted to know is where were women being excluded, but what were the scientific reasons as to why. So we started with, the confrontation was the tactic, but the content always started with science and so on. There are things that we might not know, or was it just bigotry in a white lab coat? And that makes people nervous, because people like to think, oh, the more educated you are, the less bias you have. You have to look into your heart and into your management. So we said, okay. They said, we're in. So on a particular day in the fall, when there was only an acting director at NIH, Connie Morella, a Republican woman from Maryland, a congresswoman, Congresswoman Olympia Snowe, my very, very dear friend, along with Connie, and Pat Schroeder, a Democrat firebrand from Colorado, and I showed up at NIH. But we announced we were coming, because if you don't get press, it didn't happen. We asked that we be live streamed throughout NIH, the dawn of the digital. And when we pulled up, the president at that time, George Herbert Walker Bush, by the very fact that we showed up, appointed Bernadine Healy to be the head of NIH. So that announcement was made as we hit the curve. When we went into the offices, we went around the room. I won't go into every detail, but the fact is that we were systematically excluded, that there weren't scientific reasons. I got things like, well, we didn't do it because we didn't have a bathroom. Then you had esteemed people. There were no bathrooms for women. Well, there were no bathrooms for women in the Senate. Nancy and I it took getting 15 of us before we got our own bathroom. You know, this bathroom phobia. This bathroom phobia. You public healthers are going to have to tell me, what the hell is the bathroom phobia? But anyway, what we recommended and what we came up with among ourselves, and Senator Olympia Snowe was our Republican champion, we established the Office of Women's Health at NIH. The Office of Women's Health. We did not do an institute, but an office that would cut across all research to see where we were included in the protocols, what were our research needs, and were we even in the psyche. Now, at the same time, Dr. Healy, 2 years later, called and said, Senator Mikulski, I'm going to do a hormone replacement study, a longitudinal study. There's all kinds of evidence and so on that hormone replacement might have a derogatory effect on women. We don't know. My response was, Dr. Healy, you don't want senators to earmark research at NIH. Don't go there. I can't go there. I won't have support. The end of the story is working with the men of the Senate, a Democrat, Tom Harkin, a Republican, Arlen Specter, we established a discretionary fund for the director to use for unanticipated research needs. That started the hormone study. The end of the story is this. So the study goes forward. And Dr. Healy, who, by the way, is a graduate, did her residency in cardiology here. Dr. Healy herself developed brain cancer. We stayed in touch, and really now when I heard that the clock was really ticking on her and I called her, I said, you know, Bernadine, and I get very misty when I talk about this final conversation. I said, did you read the New York Times? Apart from what all the CDC and NIH is telling us, the Times is reporting to the general public the hormone replacement study, which has now affected medical practice, has reduced breast cancer rates by 15%. Now, as public healthers, you know that's saving lives a million at a time. Yeah. So that's what we did. But what we did was we always worked, we were clear on our agenda, include the women, make it scientifically appropriated, and put the money and the resources behind it. And we used confrontation, then we used legislation. We always stuck with established protocols, and then we went out of the box. Isn't that an incredible story?
That's awesome.
But you know, you've got to find the will and the way. None of the academies called for this. None of the professional associations blew the whistle. They were all afraid of losing their money. And I think we ought to talk about that. You know, one of the things that everybody worries about is, and I know you've said people are shy about advocacy because they're afraid that they won't be viewed as objective. And well, let's come back to that. But in most instances, they're afraid of not getting their money, that there's going to be a retaliation. I think that has a bona fide component to it. That's why you need to work through professional associations and other organizations. We could be bold and bodacious, Connie, Pat, Olympia, Barb, Nancy, because We had the power of our position as elected representatives. But who has that kind of power? So really working through associations, and that's, I really would encourage you, that's what you need to do. You need to be part of an organization that is part of an advocacy effort, so that it's not you, it's we. So behind the idea is really a whole lot of we, which in and of itself has power. Those against you will have money. You have the many. So money is one thing. The many, even in a professional association, is another.
That's really helpful. And I think, you know, a lot of people here are embarking on their career or conducting their research and wanting to make a difference. Can you tell us, so you already talked about the importance of we and being part of an organization, a movement to make change, but are there other important lessons you've learned as a public health advocate of how we can be more effective as public health practitioners in academia or in the community?
Well, first of all, that's very broad.
Yes.
So what did you have in mind?
So is there, just to be able to push policy from the outside, where we sit, either at the university or in the community, are there things where, that you've seen that can be, in addition to the point you made about being a we rather than as an I, are there any other strategies that we can use or things that we should keep in mind, being in academia, maintaining our credibility, but being able to make change at the same time?
Well, I'm glad you brought this up. First of all, I think for many people, particularly those who really have a very strong research interest and so on, that the very word advocacy sounds like an extroverted word. Already it's a charged word, advocate, you know, and people say, well, that's just not me, or I'm apprehensive, or what you told me, doctor, which I found a little surprising, which is that people are afraid that they will be judged as not being neutral. This whole value-free, which I don't believe in. If you're value-free, then how could you be in what you're in? You have values. You believe in the dignity of human beings and you want their lives to be better. That's why you're here. A considerable effort and debt. Believe me, I'm meeting you where you are, and so on. But again, one of which is this. I think, first of all, you need to pick an area and stick to it. So this is not only in your field of study or your professional career and so on, but as you look at the larger world, whether it's housing, whether it's civil rights, whether it's women's rights, the various constituents, the LGBTQ efforts here, and stick to it. The second is that you need to be able to, apart from your career, invest either in your time or your money or both. There are things that you can do that don't require you to do anything except make a donation, large or small. And I'm talking now about existing organizations. So look at ACLU. Look at Planned Parenthood. And look at the onslaught on Planned Parenthood. So nobody knows that you're supporting Planned Parenthood. And I'm not saying that you be secret or ashamed of it, but if you're worried or you don't have the time. The other is that you can invest your, and I want to talk about money there, you can also invest in supporting candidates. You can also look at where is your organization going to have meetings. I was so proud of the Komen Foundation, which has its roots in a Republican family in Texas, very close to Senator, very friends with Senator Kay Bailey Hutchinson. And they canceled their convention at Mar-a-Lago. The Boy Scouts, which have at one time got mixed reviews in terms of openness of membership, canceled that. So I'm not advocating boycott everybody or whatever, but there are things you can do. There are things you can get your organization to do. I'm going to talk about two other things that are coming up that I think we really need your help on. One, the census. And I say this to the leadership here at Hopkins, because I know this city. In 2020, we're going to take the census. This is huge. To quote my friend Bernie Sanders, this is huge, it's really huge. It might not be a single payer system, but it's a single census system. I love him, and he's consistent, he's just everything you see him to be. Anyway, why is the census important? And this is really crucial to you as public healthers. And it doesn't involve politics. It doesn't involve neutrality. Okay. See, I don't think you should be neutral about racism. I don't think you ought to be neutral about racism. I don't think you ought to be neutral about that. There are some things you're just not neutral about. But helping this city and this state and our country, wherever you're going to be, so much in a community is determined by the census. So first of all, politically, it determines redistricting. So that's important. The second thing is, so much federal funds comes based on the census. And if you get a good census, you can automatically, if everybody counts and everybody's counted. Now, why is public health and the social workers and all going to play a role? People are afraid in this country to be counted. Remember, it documents the people who are here, not those who are citizens. You don't have to be a citizen to be counted, but people are afraid. The undocumented will be terrified. And yet, look at Baltimore. The other area where it will be difficult to count people, not only marginalized populations like the homeless, who should be counted, but also those that are living squished up into housing. So if you've got 3 families living where there should be 1, they don't want to tell the truth. So we're going to need your thinking, and I would hope this institution would play a role also with not only the city, but so on how can we do effective outreach. I don't want to go off on this. I have fund the census and so on. We haven't gotten it right yet, but we must count the people. The last thing, because we're holding up the 2-minute sign, if you want to be politically involved, but you don't want to sign up for a political party, please do voter registration. Voter registration and voter turnout. People need to be registered. I want to see everyone who is eligible to vote at the Johns Hopkins Bloomberg School to be registered and to turn out. We need big turnouts, and there are big seats that are at stake. So wherever you are, and those are 2 groups where you can be involved with civic organizations like the League of Women Voters. And if any way some scientific group tells you lost your objectivity because you registered people through the NACP, then quit the organization, don't quit registering.
So you'll not be surprised to know that David and Joanna had many more questions that they wanted to talk with Senator Mikulski about. But we are coming to the end of this session, and we do want to make time for some questions from the audience. This is a really exciting time to be part of the Johns Hopkins Bloomberg School of Public Health. Some days we wake up and we're quite pessimistic when we listen to the news, but today, listening to Senator Mikulski, I think we have not only some optimism, but some practical advice on how to move forward. And I want to thank you for that, Senator. This was an amazing inspiration for all of us.
Off the benches and into the trenches.
So we have two mic runners. I'd like to see hands, and I'll try and take as many questions as I can, but that will require that you be as brief as possible. That includes you, Senator. There's one up here.
Got a microphone?
She's running.
Thank you for that great chat. It's nice to hear optimism early in the morning. In the world of alternative facts, how can public health professionals as well as researchers in public health can play a role, more on an active role, I think, to debunk some of this myths out there? I work in sexual reproductive health, so I felt like I've always faced with alternative facts my entire career, but I think climate change now facing that. So would you give an advice from this sort of academia research institution as practitioner advice to all of us? Thank you.
Well, I think that's an excellent question, and it is something that has emerged really, I would say, in prominence in really the last 7 or 8 years. Really, the denial of empirical evidence. And I have seen the rise of it, not only in areas like global warming and the planetary climate change, but also in something like Zika. And it was a shock to me. So when Zika was in Brazil and we knew Zika was on the rise, we had coming to talk to us our government officials who were bringing epidemiology. 2 in particular, Dr. Frieden, the head of CDC, an enormously accomplished professional, but he was speaking from CDC with epidemiology. Dr. Fauci, who himself should win the Nobel Prize for what he did on AIDS alone, but also speaking on infectious disease and et cetera. There was a denial that the mosquitoes were coming. Oh, yeah, they might be in Brazil, and there's Puerto Rico. They squander their money anyway on rum and Coca-Cola. This is what we hear from some of our colleagues, but here at forums, with the basic tool that you all use, and that we count on is epidemiology. And we saw the denial of Zika coming, even though it was in Florida and Carolina. And mosquitoes don't know about walls. Mosquitoes don't need passports. They ignored the travel ban. And there they were. And my answer to that, though, was we needed Fauci and Frieden, the World Health Organization, to stick to their scientific facts, that they were coming. What was needed in the tried and true things of prevention in terms of pools of water, all the things, again, as public health, you would know about mosquitoes and all the things that they did. So you're going to run into this world. It's the latest thing. And then the fake news, even then, not only says you are alternative news, but that the fake news is implying that it not only is it the new reality, but first of all, the only antidote to fake is truth. So I say to you as professionals, stick to your profession. Stick to the scientific method. Stick to the tools of your profession that have been developed and honed over the years. And even though there will be those that will attack you or undermine you or try to dilute you or divert you, there will be others who don't. So there were others of us who were going to work on Zika who needed Fauci. We needed Frieden. We needed the public health commissioners. We saw how worn already in states with budget cuts, the public health infrastructure had been worn down. So we knew that we were needed. So the answer to that is they're going to do that. They're going to count on you being discouraged. And they're also going to count on you chasing that tail. You stick to your own story. You stick to your own objective. Don't go chasing the tail of what they do. And also, get out of responding to every tweet. You're going to be exhausted. It's tweet fatigue.
So we have time for one more question. It's painful
Okay, I'm
for me
sorry.
to say that, but okay, go ahead. Good. Did you have something else?
No,
Go
I'll
ahead.
come back to it.
Okay.
I have the
I want to
microphone.
talk about
I won. I have the
fatigue.
microphone.
Here's one over here.
Senator Mikulski, truly inspirational. So, Kellogg Schwab, I'd like to get your thoughts. I'm a bench scientist, but I'm converting now, talking to my colleagues in family planning, where we're linking women empowerment and family planning with water, sanitation, and hygiene. My question to you, though, is how do you perpetually redefine yourself but stay true as things adapt and change? You've had a long career, and it sounds like you held true, but you realized that there were things on the horizon that were incredibly important, but we get inundated with this. And so I'd like to get your thoughts and perspectives as we, as coming from public health professionals, choose these battles that you define us in there. What do we do to make sure that we can stick true to ourselves, but then also address the needs? People expect us to be experts on everything, but we need to hold true to these things. And
Well,
your
don't
thoughts
get
on
lost in being an expert. I mean, be an expert. And that will be, by many, more than you might think, valued and respected. But you've got to look at yourself and your own values, and also who you can influence. That's a whole other topic. But first of all, be clear on your own principles and your own code of ethics and your own code of conduct. I wrote down some that I have for the social workers where I'm going to be talking, but I think they're also for all of us in these fields. First of all, the principle that all people are worthy of respect, and they have a right to be heard, and they have a right to be represented. And then as you work on systems and policies, they must serve the people, not the people serve the system. You must be the advocate of the people you serve, because you have a position that they will never have. You will be at the table. You don't necessarily have to pound the table, but you can be at the table. You must help be the voice for those who have no voice, or to try to get them included in whatever methods that you can develop. And remember that no matter who you are or what you're doing, these principles of basic human decency, basic human rights, and also, I'm going to say something else. Whether you are from the United States or an international student, we all have to be citizens of the world. But remember what our Constitution provides. It provides the First Amendment. The right to speak, the right to organize, the right to mobilize, and so on, and make use of that. Whether you support an organization, whether you're on a march, or whether you're at the table. A quick word, though, about tweet fatigue. Oh, my God, I had the same thing. And in fact, with some of my pals in Washington, they developed what they called the Trump rump. They went into all the comfort foods, and they were having drinks that they didn't, and they were doing French fries instead of kale, and OD, potato chips, and all of this. But the fact is pick an area. Don't pick all areas. Support your colleagues who might be doing. Your area might be housing. Your area might be water. Your area might be, overall, is empowerment. But you can support those in the other areas. But don't think you've got to respond. Because I do believe this continual keeping us all on edge is a deliberate tactic. I think it's a source of distraction. I think it's a source of using up our psychic energy and also using up our resources. So keep an eye on it. And if they're outrageous or they're vulgar or they're violent, of course we are called to a response. It's a moral call. But the point is, you stick to your area, be best at what you're best at, be best at what you're best at, and be best at what you're needed for, and be willing to collaborate and share and organize with others.
Senator Mikulski, on behalf of the Center for Public Health Advocacy, all the student and faculty and staff advocates here at the school, I want to thank you. You're in high demand here at the university, and we appreciate the hour that you spared to speak with us. You are truly inspiring. For any of you who need another dose, in the future, we will have this webcast on our Center for Public Health Advocacy website going forward. I think every once in a while it might be just what we need to get us up and moving and remind us what we need to do as public health professionals. So thank you, everyone. And I want to thank Drs. Jernigan and Cohen for being on the panel, my fellow co-director Oying for kicking us off, and all of you for being here. Is there something I missed? I'm looking at all of you.
May the force be with us.